Go.
Welcome to the podcast. Michael Johnson here, acupuncturist, and today's exciting because we're going to be talking about erectile dysfunction, which does not get talked about enough. So, my name is Michael Johnson. Like I said, I've been practicing acupuncture for 15 years, and I've seen a lot of men's health issues. And one of the ones at the top of the list is erectile dysfunction. With me is Dr. May, an expert in the field, and I'll let him introduce himself.
Yeah, great. So yeah, I'm Dr. May. I'm a naturopathic physician, board certified in endocrinology, and like Mike, I've been practicing for 15 years as well. And for both of us, we both have a passion for men's health. We think that this is an underserved area of our demographics, and some of that's our guys. It's our own fault. We don't do a very good job of taking care of ourselves. So hopefully, some of the information that we can provide today and with future podcasts can kind of give you some updated information so that you can make better decisions about your health and be more proactive. Yeah.
Absolutely. While we're talking about erectile dysfunction, like exactly what does that mean? Does that just mean you can't get an erection or are there different definitions?
Yeah. So usually there are symptoms of erectile dysfunction, and that can be any combination of either trouble getting an erection, trouble maintaining an erection, reduced sexual desire, being able to get an erection sometimes, but not every time that you want to have sex, or being able to have an erection but not having it last long enough for sex, or being unable to get an erection at any time. So it can be any sort of iteration of any of those potential symptoms there. It's We don't have really great diagnostic tools for ED. Most of this is a clinical diagnosis, which means that it's based on symptoms. So when you go in, your doctor's going to ask you, all of these questions, and if you have a decent number of them, then it's likely you have erectile dysfunction. Now, you can go to a urologist and they can do some specific testing, like an ultrasound. One's called a nocturnal penile tumescence, which is basically measuring nighttime erections with special devices. It's funny, they used to do like a tape measure or a band aid sort of approach, where basically they would wrap that around the base of the penis. And if it broke, through the night, or they would use stamps, and so they would wrap stamps around, and if the stamps broke through the middle of the night, then that told you that you were at least having an erection. Anyway, they've got better tools for that now. And then there's also an injection test where they inject your penis with a stimulant that increases blood flow and allows for an erection. And so again, those are kind of a little bit more invasive. So most guys don't jump to that, and most primary carers won't jump to that. So they'll base this strictly on clinical, questionnaires and things like that, and then make that decision, and then start treating and see if your erections actually improve.
That's interesting because it's like similar to our way of looking at things, asking a lot of questions, figuring out exactly where that person is.
Mm,
And I'm glad you pointed out that it doesn't just have to be like can't get an erection because that's what a lot of people.
mm,
It's kind of a misnomer. It's like you hear erectile dysfunction, it's like you can't do it at all. That's it. And nobody,
mm.
I won't say nobody, most people don't think of like, am I getting an erection that lasts long enough? Am I, happy? Is it a full erection? Is it the same as it was? And it ain't gonna be exactly the same as 20 years ago if you're older. But, is
Mhm,
it, what level are we talking about here? And too many people think I'm not going to talk to my doctor because,
mhm.
oh well, it's not actually erectile dysfunction. I can still have somewhat of an erection. I can still have somewhat of what I'm looking for. And people don't realize like
Yeah,
there's different levels. I mean, you definitely want to get help even when it's earlier on.
absolutely. And so I tell guys this all the time, that your erections are a great litmus for so many different aspects of your health: your cardiovascular health, your neurological health, your psychological health. So if you start seeing changes in that erectile quality, it could be a first warning sign for other system failures there. And those are it's one of the more sensitive indicators for those other systems. Because you think about it, our cardiovascular system, for instance, you've got smaller blood vessels down there. So if those smaller blood vessels are starting to be affected by, let's say, plaque buildup, which is affecting your blood flow to that area, and you're starting to affect your erections, well, you have places where with other small blood vessels, like inside your heart, inside your kidneys, inside your brain. Like if
Hmm.
those are being affected, it's very likely those small blood vessels in other areas are being affected as well. And so again, this can be an early warning sign system for you.
Man, I'm glad you mentioned that. It's actually, you know what's coming. You already know what's coming if
Mhm.
you talk to me at all. But as far as organ systems affected in Chinese medicine, what do you think the main one is, Dr. Man?
I'm just gonna ponder. It's probably kidney.
Yes, it is. You win. You get the gold star. But it's interesting because
Nice.
kidney in Chinese medicine is not just kidneys; it's also reproductive. So a big part of reproduction is dealt with the kidneys because they look at the general essence and reproductive organs as also being part of that. So when you hear kidney in
Mhm.
Chinese medicine, don't think I'm having kidney failure. I need to go, freak out right now. You're also
Mhm.
talking reproduction. You're also talking, the brain to a certain extent. They look at the brain as part of the kidney function as well. All those base functions, they're really important. And they look
Mhm.
at it, from that reproductive point of view, but you're also going to have the liver. The liver is a big part because in Chinese medicine, when you're super stressed and anxious, the organ that it affects is the
Mhm.
liver. And so when you look at more of the psychological parts of ED, which there are, because it's a cascade where it's like you get stressed about not getting an erection one time. And then the next time
Mhm.
you go into full anxiety mode of like, you know what? It didn't happen last time. It was embarrassing. I felt bad. And then you get in this cycle where
Mhm.
you get stressed and anxious, can't get an erection. The more you can't get an erection, you get more stressed and anxious. And so in Chinese
Yep.
medicine, that's the liver. And then also the heart.
Mhm.
People are always wondered back in the day, why did Chinese medicine include the heart when it comes to severe erectile dysfunction? It's exactly what you just said. It's like, because there's a cardiovascular component that if you're having issues with your heart, it can affect a lot of different systems, including, your ability to get a good erection. So,
Mhm. Yeah, those are great points. And like I said, Chinese have been great observers for millennia now, and so they figured a lot of this stuff out before we had the tools to better assess these things. So
yeah.
before we jump too much into sort of causes of ED, let's talk about like how big of a problem this is to kind of give you guys more of a perspective on, is this something that, 1 out of 10 guys kind of deal with, or is it more or less than that? So let me share a few stats with you. So based on the study, it, it's indicated that somewhere between about 18 to 30 million men in America are dealing with some level of erectile dysfunction. And that's
Wow.
typically about 18.4% of men over the age of 20 in the US.
That's huge.
Now, yeah, that's a massive number. Age-related prevalence: about 26% of men younger than the age of 40 have ED. 40% of men at the age of 40 have it, and then 70% of men at the age of 70 have it. And there was this big study done on 8 different countries. The US was part of that. The US had by far the highest rate of erectile dysfunction at 22% in that
Hmm.
study. So we're seeing
Interesting.
some pretty significant numbers. And I can tell you, based on the number of men that I've seen over the years, rarely do I have a guy come in purely for erectile dysfunction. It's not
Yeah.
until you kind of prod and poke and ask these kind of questions do they actually start divulging. So we have to probably assume that these numbers are pretty conservative numbers and that they're likely much higher than what are being actually reported. Now,
Yeah. That's
that's
my
my kind of
experience as
take on
well.
it. Yeah.
Yeah,
Yeah.
that's my experience as well. It's like even when a guy comes in specifically for ED, sometimes they won't even mention it till the third or fourth visit. And
Mhm.
then finally, like we've spent 3 visits, they paid some money, and are like, oh, and by the way, can you help with this? I've noticed, I can't keep an
Mhm.
erection as long as I would like to. And they always have this not always, but often have this embarrassed, like, I don't want to talk about this look. Why do you think there's a stigma around this? Like from your experience, why is this a stigma for men?
Yeah, that's a great question. I'm at a loss to some extent, just because erections for most men are really important. It's like we pay attention to that stuff. And for most guys, when you start poking and prodding and asking those questions, they know the answer to it. It's not like they're not aware of their erections or the change in quality. So it's like it's one of those things. Most of us are pretty hyper aware of it, but we're not talking
Mhm.
about it. And I don't know if it's to this goes back to this sort of stigma that, we just need to buck up and do more or do it better, or we need to solve these problems ourselves. And when it comes to this kind of stuff, it that just generally doesn't work out that way.
That's a good point. I wonder how much of it's societal as well. It's like one of the reasons we're doing
Mm,
that with this season, we're so focused and on the future, focused on men's health, I feel like, is that there is a stigma for a lot of men that they just don't feel like they can talk about their health problems for whatever reasons. I don't know if it's a societal reason, if it's just guys being
mm,
guys. I don't know what it is, but there's definitely that issue. And one of our passions here is like, okay, you can listen to this podcast and get something out of it to be able to help yourself. Because I've noted, I have no idea why. I'm sure societal is a part of it.
mm,
I'm sure that at least 50 years ago, guys weren't supposed to talk about anything. My grandpa, he was in the Korean War. He didn't say a word about anything. I found out about it after he died
mhm.
because he was just in that generation. And things are starting to change, but they're still like guys feel like almost that they're less manly if they talk about this stuff, which is not true.
Yeah,
But
yeah. Yeah, you're right. I definitely see that in that older generation of men. I am seeing, I think, men in their 20s and 30s and kind of our age to kind of mid-ish 40s. I am seeing a bit of better sort of, tendency to open up about those things. And it's not perfect by any stretch, but I do see a little difference or a swing of change there in some of the younger men, which I think is great.
yeah, and back to prevalence, I've noticed the same thing. A lot more guys struggle with some form of ED or some severity than
Mhm.
what you would think. Because in your head, you think, this is an old person problem, and it's not something that happens very often. If you wouldn't have told me a statistic, I would have been like, yeah, 5%. Maybe
Yeah.
10% total is what I would think.
Mm. Yeah.
So, it's pretty shocking to see those numbers. And it's like, yeah, guys need to get help on this. Before we
Mhm.
move on, can I ask you a question? So
Sure.
you mentioned nighttime erections. Why is that important?
Yeah, so that's important because the process of erections is stimulated by a part of the nervous system that's called the parasympathetic nervous system, which is sort of that rest and digest aspect of the nervous system. So you actually have to be in a state of relaxation typically to have a good erection. So what better time for that than at nighttime while you're sleeping and you're resting? And
Mhm.
typically, most men during the night should have about 3 to 5 erections throughout the night, based
Hmm.
on what sort of stage of sleep that they're in. But often use that as a gauge for men, with this, talking about erectile dysfunction. And that, like, I asked them, do you often wake up with an erection, first thing in the morning? Most days out of the week. And if a guy tells me, oh, maybe once a week, once every couple of weeks, I will, then that's kind of a red flag for me. Like, all right, something is likely going on here. They're not
Yeah.
sleeping well. There's some major sleep disruption there. There's something else that's driving up stress hormones. Maybe their testosterone is low. Like, we'll go kind of go into some of those causes here in a little bit, but it's a great litmus or a great gauge for determining like how stressed you are. If you're super stressed, you're in that fight or flight mode a lot, especially like during sleep, then yeah, it's going to be really hard to have an erection because think about it. Your body's trying to survive, right? And so it's using stress hormones like cortisol and adrenaline to help you run from the bear or whatever that stress is, right? So that's not an appropriate time to have an erection when you're trying to run from a bear. right?
It's true.
So it's part of that autonomic nervous system that is the balance between fight or flight versus that rest digest aspect.
Yeah, that's a problem if you're running from a bear. It's a major problem.
be, be a little awkward.
The timing is bad, or giving a speech on stage, or something else that involves the sympathetic nervous
Ex-
system.
exactly. Yeah,
So
absolutely.
I'll hold off on the treatment part till we get there, but the parasympathetic,
Mhm.
I definitely want to come back to in regards to what we do. But before we get there, we can talk some about causes and stuff like
Yeah.
that if you like.
Yeah. So, top of the list for me is vascular issues. And this makes sense because this has to deal with blood flow to the penis. So, this could be everything from atherosclerosis, which is the hardening of the arteries, high blood pressure, high cholesterol, diabetes, heart disease. There was actually a study done, published in Circulation, which is a major cardiovascular publication back in 2018, and found that erectile dysfunction was significantly associated with increased risk of cardiovascular events, including heart
Hmm.
attacks, cardiac arrest, strokes, and heart failure. And the study looked at 1,900 men over 4 years and found that those who reported erectile dysfunction were twice as likely to experience one of those cardiovascular events than the men who didn't have erectile dysfunction.
Wow, that's significant.
Yeah,
I've never heard that.
that's that's very significant. So again, this is a very powerful first warning sign for your cardiovascular system.
Do you think people, if they are having erectile dysfunction and they can't find a cause, you think they should get their heart checked out just to make sure everything's good?
Absolutely, 100%. Yeah, you should go through a full vascular workup. So, get an ultrasound of your carotid blood vessels, get a coronary calcium score, do a treadmill stress test, like do all of those things that test your vascular system and see what they find. Because oftentimes, like that can be a big issue, and I'd say like that's one of those causes that's at the top of the list.
That's interesting because, from the Chinese medicine perspective, it's in the list, but I wouldn't say it's towards the top, and I think it's just because of
Mm,
maybe the kind of patients you see. Because I see a lot of, uh, when I was talking about the liver and stress, when you hear liver qi stagnation, that's, synonymous
mhm,
with the sympathetic nervous system being constantly activated. You can't turn it off. It's just constant.
mhm,
That's one of the big things I'll see, but it's mainly just because of, I think, of the type of patients that are coming in to see me.
mhm,
I also see people with nerve damage. I've seen quite a few people with nerve damage in their lower back that affects their
mhm.
erections as well,
Yep.
cardiovascular effects, stuff like that.
Yeah. So yeah, you're right. Neurological wise, like this could be spinal cord injuries, any damage there at the base, the root nerves that innervate the penis, which are going to be in those lumbar sacral nerves. Stroke, Parkinson's disease, MS. Those are a few different conditions that can affect the neurological innervation to the penis.
Are there ever just unknown, like we don't know why, but you're just not getting erections?
Yeah, I mean, there's a few other causes. There's like the hormonal imbalances, so like low testosterone is another one that's high up the list. There are medications, and we know a few of these, like blood pressure medications, certain antidepressants, certain anti-androgens that are used for like prostate cancer. Even some ulcer medications can cause some issues. Nutrient deficiencies can kind of lead into this too to some
Hmm.
extent. Like folic acid is one that's been heavily studied. And that one, there are a lot of good studies on folic acid and not having enough of it correlated to erectile dysfunction. We don't really know as far as causation, like how it relates to that, but we know that there's a pretty strong correlation there. And that's part of like the whole nitric oxide pathway. So nitric
Mhm.
oxide is that pathway that helps to dilate blood vessels. So it's kind of one of the big triggers for an erection. And so if that cascade is not working because you're deficient in certain nutrients like folic acid, L-arginine, L-citrulline, those are a couple amino acids that stimulate that. Then obviously it's going to affect your vascular system and your ability to dilate those smaller blood vessels. So that's other causes there. You got lifestyle factors, so like smoking, excessive alcohol use, being too sedentary, being overweight or obese. Like a lot of especially when you got a lot of visceral fat, and that's actually creating some pelvic congestion. So it's putting pressure on all those blood vessels there in your pelvis, which can affect circulation to the penis as well. So losing some weight, taking some pressure off of those areas. Don't sit as much because that can do it too, like just creating that pelvic congestion. Um, let's see what else. Prolonged bicycling. I've seen this a few times in guys who are like athletes that are, doing competitive cycling. Just that pressure on the nerves there, you can get nerve damage to those
Hmm.
perineal nerves. Um,
I've
Peyronie's
seen that.
disease, which is where there's scar tissue that develops in the penis, and this is where guys get like a significant curvature in the penis, and which makes it difficult for a full erection and then intercourse, with that.
Yeah. And that makes sense. And I've seen a lot of the same things. I usually diagnose from more of the Chinese medicine perspective, but
Mhm,
I would say I see a lot of people coming in who aren't sleeping well, don't have a great lifestyle, stressed all the time, maybe high stress jobs,
mhm,
maybe some high blood pressure thrown into the mix, or I'll see people with just long term nerve issues in their low back and sacrum that are affecting things,
mhm.
stuff like that. That's what I typically see when people come in and when they're finally ready to talk about it. So
Yeah, yeah, I agree. Like top of my list is typically stress. So when guys are like highly stressed, for whatever reason, work, relationship, whatever it is. Again, they're in that sort of sympathetic nervous system state way too much, and they don't know how to calm down. They don't know how to deal with stress because we're not really taught that in our society as a whole, but especially for guys. Like we don't talk about feelings and stress management and how to meditate or how to deep breathe or how to do things to help kind of calm that sympathetic nervous system. And one of the first indicators of that is erectile quality. Um,
yeah.
so that's a big one. Like the low back pain, again, like you were saying, that's a huge one as well, especially if guys are very active, they're in construction or whatever else that, or just guys who sit on their butts all day, like us. Like, it's we sit too much, that can wreck our low back as well. And then this could be a consequence of that.
And you need to listen to the last episode we did last week, but we mentioned just working out for 45 minutes a day is not the same as moving around all day. So you can listen to that podcast.
Mm.
We talked about that. But you
Yeah.
absolutely
Yeah.
need to actually be moving more than just, I went to the gym for 45 minutes. Now I'm going to play video games for 6 hours.
Hmm. Yeah, absolutely.
So what do
Yeah.
you do about it?
Another,
Somebody comes in. Oh, go ahead. Sorry.
well, just another kind of one to throw out there that something that you can evaluate as well is what's called refractory time. And this is the time that it takes to go from one orgasm to being able to experience another one.
Hmm.
And, for guys in their 20s, that number is around, 18 minutes to 20 minutes, somewhere in that range. Could be, less than that for many. But once you start getting into 30s and 40s, now that time is somewhere around 30 minutes to an hour. And then, once you're in your late 60s, early 70s, or beyond that, that could be as long as 20 hours
Oh,
between
wow.
the ability to kind of turn over again. So that can be another sort of indicator or flag. If you normally have a refractory time of 30 minutes or an hour, and now it's 2 or 3 or 4 hours, like that could be another sort of early warning sign that something's going on there.
Nice. So somebody comes in, you're evaluating what's going on, why they aren't having erections. What's kind of the next step? What do you look at as far as helping them? Can you help them immediately, or is it just this is going to take
Mhm.
forever? Buckle up, tough luck.
Yeah. So it kind of depends on what the issue is, right? Maybe if we can figure out what the root cause is, then we have a better chance of fixing it. So I kind of do like my top 5 treatment strategies for ED. One, and this is the most important one, is find the root cause, like treat the underlying issue. If that's stress, if it's vascular health, if it's low testosterone, whatever that might be, like you got to start there. So we can throw the kitchen sink at you as far as medications and supplements and herbs and all that kind of stuff. But if we're not actually addressing the root cause, you're going to be minimally effective at best. And
Yeah.
so that's where you want to start first, in my opinion.
And I like that because same thing with what we do is like we call it the root and the branches. It's like you can
Hmm.
treat the branches all day, but if you don't get to the root, it's just going to come right back, and you're
Mm,
still going to have the same exact
nice.
problem. So you always
Yeah,
want to find
I
that
like that.
root. Yeah, you want to find that
Mhm.
root, and you can still treat the symptoms, the branches, but you also have to treat the root, or you're just not going to get any lasting results. You may get transient, short-term results, but you aren't going to get lasting
Mhm.
results unless you deal with both.
Absolutely, 100% agree. I like that analogy though, the branches and the root.
hmm
Uh,
So that's you want to find the root. What's kind of in the next strategy and treatment? Once you find like, okay,
yeah.
I think that this is the root problem.
Okay. So, other treatment strategies would include exercise. So there are tons of studies. Last I looked, there were 11 like really great solid studies just on exercise's effect on erectile dysfunction. And it's overwhelmingly positive. And it makes sense, especially when a good deal of this is likely vascular, or it's psychological, and exercise can improve both of those scenarios. So, starting with exercise, and most of these studies range somewhere between exercising, like cardiovascular exercise, 3 to 5 days a week for 30 to 60 minutes at a time. But this was moderate exercise. Most of this was in what we call zone two cardio, which is around that 60 to 70% of your max heart rate, which is not bad. For me, that's like, 110, 125 beats a minute. That's not very intense, but it's something that you can sustain for 30 to 60 minutes. And it doesn't
Nice.
always have to be just like jumping on a treadmill. For me, I can do high intensity interval training like with weights and keep my heart rate in that heart rate zone for 60 minutes just doing that.
I like that. Yeah, and I focus a lot on lifestyle also. It's funny you talk about movement. I was talking about liver qi stagnation earlier, which is kind of that stress, anxious, like on edge,
Hmm.
sympathetic response. And one of the big things for that is movement. Like, and also you focus on a lot of eating a lot of leafy greens, stuff in season,
Hmm.
healthy meats, and then you're going to move, and it's going to help move that energy. It's going to help, act, from our perspective, also from the Western perspective, activating parasympathetic nervous system stuff that's going to
Hmm.
get people to that relaxed state where you can, alleviate some of the anxiety and depression that can really affect all of this. And by the way, we forgot to mention it can be multiple things at once. You can have some minor
Yeah.
cardiovascular stuff, and you have this anxiety and sympathetic nervous system, and they feed into each other. That's completely possible.
100%. Absolutely. Yeah, there could definitely be multiple ideologies here going on at the same time. And they can kind of perpetuate and feed each other, right? It's like if you're
Yep.
super stressed, you're likely not eating as well. You're probably not exercising as much. Your vascular system can definitely be affected by this. It's like all these things can kind of tie in together. And you're right, it's usually not just one single thing that's affecting this. And if you're having erectile dysfunction, it's likely due to multiple things. It's not
Yep.
just gonna be one
Yep.
typically.
And
Yeah.
earlier you
So,
mentioned
so
correlate.
good.
Go ahead.
Yeah.
Earlier you mentioned correlation. People
Mhm,
need to realize that correlation and causation are different. So you can have multiple things that correlate, so they come together, but that doesn't
mhm.
necessarily mean that one caused the other. That's really important to remember with this because it's very easy to look at
Absolutely.
something and like, this caused this. And it's like, the study may not say that. The study may say, we see people with
Mhm,
cardiovascular issues who also tend to have erectile dysfunction. But you
mhm.
mentioned there's a lot of lifestyle stuff that can also feed into that, that could be adding to that. So, yes, it's a strong correlation, but it doesn't tell you what the direct cause is, probably because there's multiple causes.
Yeah, absolutely. Yeah, so, we talked about, like, treating the root cause. We talked a little bit about exercise. You had mentioned some, dietary kinda nutritional changes,
Mhm,
which I agree. There's been probably the most study on the Mediterranean diet and erectile dysfunction. Yeah, we do see improvements in ED with that particular diet. Now, I wouldn't say that you have to follow a Mediterranean style diet, but of most of those that are studied, they're mostly whole food like
mhm,
diets that we see improvements. So it's not a lot of processed foods, packaged foods. It's a lot of good fruits and vegetables, nuts and seeds, not a lot of seed oil like for the Mediterranean diet. It's mostly just olive oil,
yeah,
good quality fats like fish and limited red meat. And it's like that's a good plan to kind of go with, and that's going to provide tons of antioxidants and nutrients that you need to have a healthy vascular system. And so
mhm.
it totally makes sense that you would want to go that route as far as nutrition goes.
Absolutely, and, we focus a lot on whole foods as well in Chinese medicine. It's like, cook your own foods, know where your food's coming from, don't add a bunch of crap to it, and the worst food
Yep.
in Chinese medicine, I've said it before, is ice cream. It's one of my favorite foods, and it's considered
Mm,
the worst food by every Chinese teacher I asked. The worst
mm,
food because 'cause you're
yeah.
getting all the
It's like a
processed
like a
sugar and
dampening, right?
yeah, it's a
Yeah.
damp and it
Yep.
adds to inflammation. It's gonna boost
Hmm.
up your sympathetic nervous system. It's all the bad
Mm.
things you don't want that taste
Nice.
nice.
All right. Yeah, I know, right? Well, that's always the case, right?
They
Oh,
taste
why
great.
can't that be like Brussels sprouts that does
It's
that
true. It's
with
like
ice
broccoli
cream?
is the worst for erectile dysfunction. Don't eat broccoli.
Uh-huh. That would be great. All right, so we talked about nutrition. Sleep would be the next one. So this one's
Oh, yeah.
huge for a lot of guys, especially as we start getting older. We start gaining weight, especially around our neck, and we start developing a little sleep apnea. So this is, if you do have sleep apnea, you're not sleeping deep through the night, and that's a stress in your body. You start breathing, for periods of time, depending on how significant it is, and that's a major stress on your system. So your body's going to produce stress hormones during that period because it thinks you're dying, and it's not going to produce hormones that you're going to produce while you're rested, like testosterone. So we do see this significant correlation between sleep apnea or sleep disruption and low testosterone. Okay.
Mm.
And increase in blood pressure. So, again, we've got that vascular component in there as well. So, like sleep apnea and sleep disruption are a huge one. Or if maybe you do shift work, and your sleep schedule is all over the place. You don't have a set routine or rhythm. So you never feel like you get like great quality and great length of sleep, then this could definitely be something that's playing into your ED.
Yeah, and I treat a lot of sleep issues too for any chronic issues. If somebody has, chronic pain, if somebody has erectile dysfunction, sleep almost always plays a role in
Mhm.
just about everything. And so if somebody's not sleeping well, one thing I'm gonna work on with acupuncture is I'm gonna work on sleep, period. And I'll work on it with herbs
Yeah.
too, just to get people sleeping better.
I tell people all the time, like that is the number one obstacle to good health is
Mhm.
poor sleep. And if you're not getting sleep, again, we can kind of throw the kitchen sink at you, but you're going to get minimal effectiveness with those interventions if we're not addressing the sleep aspect. And just on a side note, guys, if you have sleep apnea and you are treated for low testosterone with testosterone replacement, you could actually make your sleep apnea worse. So if you're considering testosterone replacement because you have low T and you haven't been assessed for sleep apnea, that's top of the list. You got to get that done.
Preach, brother, preach. I agree.
Yeah.
And heart and kidney in
All right.
Chinese medicine are going to affect the sleep a lot, as well as liver, all the same stuff that affects ED. So,
Hmm. All right. Sounds like we're vibing here. Um, and the last one is stress. So we'd already kind of talked through this a little bit, but really developing good stress management techniques. And you have to be just as intentional with this as you would your diet, your exercise regimen, protecting your sleep, all of that stuff. You've got to be very intentional about this. Most of the time, we tend to use distraction techniques to help us with stress or manage stress. Things like, just getting on our phone or watching TV or a movie, any of those kind of things, or even exercise to some extent is a distraction technique, in that it just helps distract our brain from whatever is stressing us out. But
Yeah.
it really doesn't help necessarily to dissipate that stress or work through that stress. And that's where things like meditation, deep breathing, like guided imagery, some of those things to kind of actually help you process through that stressor can be a better longer term solution. Doesn't mean you can't use those distraction techniques, but just don't only use those distraction techniques.
Yeah. Same as acupuncture. It's like I work a lot with stress because one thing acupuncture does, especially if you're doing the right points, is it activates the parasympathetic nervous system. So it's going to help you, calm down that sympathetic response. You're going to have less anxiety, less stress. You're going to have better sleep, and that's going to lead to better erections. So something else I tend to focus on is I've had a couple patients that came in with severe nerve damage, and they were told by their medical doctor, their primary care,
Mhm.
that you're just not ever going to be able to have good erections. Tough luck. And so, but they didn't
Mm,
really do a lot of anything beyond that. And so I just started
mhm.
working on the sacral nerves. I did all the points around the lower lumbar sacral nerves, pretty deep. And then under the
Mhm.
tailbone is a particularly good one. The name of that point, the Chinese name is long and strong. It's a very good point. That's the actual name.
Oh
And
man, that's great.
so I treated this patient, and usually
Uh,
treatments take a lot of visits. So I did one
mhm.
treatment, wasn't expecting much, and his wife brought me flowers and coffee the next time he came in. He's like, whatever you did, and this guy was in his early 60s. So whatever you did, just keep
Yeah.
doing that treatment every single time. Um,
Hey, she's a
and
happy customer. Yeah.
but and on him, I also worked with stress along with it because him being told that, of course, caused a great amount of stress that he hadn't really talked to anybody about. So.
Mhm. Yeah. Okay. Man, those are great, man. So one thing I'd say, like, if you go through all five of those and you're doing really well and you're still experiencing some issue there, then what are your options? Like, what else can you do? Well, obviously, seeking treatment out. So, acupuncture, um, things that I would do with you are, micronutrient testing and, working on any of those potential deficiencies that might be going on. We could try medications like sildenafil and tadalafil. That's Viagra and Cialis. Now, these work on allowing those blood vessels to dilate in the penis, so it helps enlarge. There's actually some great research on using Cialis at a low dose for long periods of time can actually help reduce blood pressure to some extent. And we're starting to see some improvement in cognitive function as well. And that's one thing I didn't really talk about earlier when we were talking about the neurological aspect, but uh, the like erectile dysfunction can also be an early detection for cognitive decline and
Hmm.
sort of a risk factor for dementia later on. And this makes sense because a good portion of dementia can be vascular related, right? If you're forming plaque in the blood vessels in your brain, then those areas of your brain that are supplied by those blood vessels aren't getting the oxygen, blood flow, and stuff that they need. So part of your brain is going to be affected by that lack of blood flow.
Makes
And
sense.
so anyway, that can be a good early warning system for you. But so try, that'd be the next step. Try those things. I love like using Cialis more so than Viagra because Viagra can cause more of the side effects, the headaches, the flushing, stuff like that that aren't really that great, especially when you're trying to be intimate. Um,
Yeah.
if if those don't work, you can actually go to penile injections, which I know don't sound great. So these would be things like Trimix, which is a solution again that's injected at the base of the penis, and it helps to relax the smooth muscle in the penis, and that helps also dilate the blood vessels, those arteries there. One that I do use more frequently is called Priapus shot. This is the P shot, and this is where we do PRP into the penis. And so PRP is platelet rich plasma. This is where we actually draw your blood. We spin it down a couple of times in a special centrifuge, and then helps to concentrate the platelets in that blood sample. And then we pull that off and we inject those platelets into different aspects of the penis. Now, this is done. We usually do a nerve block on you, and so you don't really feel it when we do that. And we use a small needle. So this can help improve vascularization in the penis. We also see improvements in girth and length too, which, I mean, I've never heard a guy complain on getting a little bigger and longer, you know. But again, those results kind of vary from person to person.
Yeah.
And then kind of last kind of strategies would be, vacuum devices, stretching devices, or obviously penile implants would be kind of your last resort for that.
Yeah. And it's interesting you mentioned the blood because part of Chinese medicine is like you're focused on blood flow, either, not enough blood's flowing or it's getting stuck somewhere. It's called stagnation. Things aren't moving and flowing as well as they could. So that's one of
Yeah.
the main treatment principles, both with herbs and with acupuncture. And there's been some
Mm.
really good studies on some herbal products, Chinese herbs. They're very effective in double blind studies for erectile dysfunction, mild to moderate. There's one called Hongjin granules, and it was shown in a huge double blind placebo controlled study to be highly significant in helping with erectile dysfunction. So, really
Mm.
beneficial stuff.
Nice.
And they think it focuses on the nitric oxide aspect of things,
Hmm.
which a lot
Yeah.
of the Chinese herbs, that's really the focus, is it's going to really help
Mhm.
with the nitric oxide. So,
Nice. That's awesome. Yeah, and obviously, my strategy, I'm sure like yours is too, like we want to start with foundational things and build on
yep.
top of that as far as your interventions go. So we're talking about low level interventions first, mostly lifestyle modifications, and then we build on those, just like building a house and starting with your foundation. So if we want to jump straight to medications or injections, that's like putting your roof on first before you lay your foundation. Like it just
Yeah.
doesn't work well that way. So kind of work through those different levels of interventions. And that gives us feedback too. Like if we're doing these foundational things and we're seeing minimal effectiveness, then obviously we know like this problem is more serious because honestly, in my opinion, those lifestyle modifications fix probably 75% of the issues that we're talking about here. So if it's not
Yeah.
fixing that, we know it's a much more serious sort of issue.
So if the idea of penile injections doesn't make you feel all warm and fuzzy, like do the lifestyle stuff, even if you don't want
Right,
to, people.
right.
Because I run into that a
Hopefully that,
lot.
yeah, hopefully that'll deter you a little bit. One kind of side note I want to throw out there, just because this was a pretty recent study done. This group out of the University of Miami, they do penile implants, and what they did was they actually did small biopsies in the penis of these men prior to implanting these implants for their significant erectile dysfunction. And what they found was 4 out of every 5 samples that they took, they found microplastics in the tissue
Oh,
of these men's
wow.
penises. Yeah. So that makes a good point in that microplastics or any of these sort of plasticizers, these are all endocrine disrupting chemicals, which means that they disrupt your endocrine, your hormone system, which includes testosterone, growth hormones, things like that, that are associated with erectile dysfunction. So it's like this could very much be, causative for erectile dysfunction, in that we're being exposed to too many of these, different types of plastics. Most have a estrogenic effect. We call them xenoestrogens. And so they stimulate your estrogen receptors, which in men we don't want a ton of. Okay. So
Mhm.
anyway, that I say that to
That's
say, try one of the interventions you can do is just try to clean up your environment more. So never heat up your food in plastics. Like try to avoid, any sort of contact of plastics to your food. No plastic water bottles. Use stainless steel or glass. Even simple things like the receipts that you get at the grocery store. the thermal ink that they use has BPA, which is a known endocrine disruptor. So it's
Hmm.
like, don't handle that stuff. If you don't need your receipt, don't take it. Um, so, little things like that. There's a great group called the Environmental Working Group, and they go through the sort of dirty dozen of endocrine disrupting chemicals on their website. So I generally send people there, let them read through that. And they also show you ways to reduce your exposure to all of those
You're the reason I don't warm up things in plastic, by the way, because years ago, Dr. May told me he saw me warming up something in plastic, and he's just like, "So you trying to get some boobs?" I said,
Uh-huh. That's
"No,
right.
no, I'm
That's
not."
right.
And he's like, "Well, then you should probably stop heating up things in plastic." And that stuck with me, and I stopped to this day.
Nice, nice. Yeah, yeah. Unless you want to work on those man boobs, you better stop it.
So, hey, you want a good
Mm,
erection? Maybe you should stop using warming up things in your plastics. So.
That's right. It's a good place to start.
I do like though, I mean, we're towards the end of the show here, but I love the focus on things that people can be doing. I mean, a lot of this podcast, we want you to be able to do things at home that could help you. And so if you start implementing some of
Yep.
these things, it's already going to help. Even if you need to come in and see us or someone else, you're already going to have some benefit just by adding this lifestyle stuff.
100%. Well said. All right. All right, man. Well, anything else you want to throw in before we wrap things up?
No, I'm gonna do the same thing I do almost every freaking episode, which is go get help. If you're struggling with this, I know you don't want to talk about this. I know you're gonna think, oh, what are they gonna think? They aren't gonna think anything. They're medical practitioners. Just go in, tell them what's going
Yep.
on, see how you can get help.
Absolutely. Yeah. If you really want to man up, then get in and see your provider and get this stuff taken care of. Like, you really want to man up, then be straight up and go in and get it done, get it taken care of. Don't just be sort of laissez-faire here about
Yeah.
this and let it go until something really significant happens, like a heart attack. By the way, half of heart attacks in men result in death. So, not a great early warning sign for you guys. And even if you do survive that first heart attack, it's likely that it's affected you in some major way
Yeah.
after that. And it's going to decrease your quality of life. So, don't wait till then. Use ED as a sort of silver lining, if you will, that this can be an early detection of bigger things down the road that you could be preventing.
Yeah, and you're not only improving your life, but you're going to be around longer for your family you care about, and you're improving your partner's life because if you're
Yep.
stressed about it, I can guarantee they're stressed about it, even if you haven't talked about it.
Yep. Yeah, totally agree.
So
All
yeah,
right,
this
man.
is
Great
good stuff,
show.
man.
Yeah, good stuff. All right, guys. Thanks for tuning in. We really appreciate you listening to us this far. Just continue to stay with us. And again, if you have any questions, you have any topics that you'd like for us to discuss, just leave us a comment, let us know, and we'll try to get to those as best we can.
Hey, thanks for listening, and thanks, Dr. May.
Yeah, take care. See you, Mike.
See ya.